Today, I'll be talking about the issues and misconceptions regarding the most basic of physical findings. What is a normal heart rate? That is, the number of times per minute that your heart contracts, pushes blood through the body, and generates a pulse. Now, if you're thinking, everyone knows it's 60 to 100, what's the big deal? Well, you may be right that everyone knows it, but the problem is that everyone is also wrong. When talking about what constitutes a normal heart rate, there are a couple things I need to clarify. First, I'm referring to a normal resting heart rate. The resting heart rate is the rate you experience when you've been sitting or lying still for several minutes with no significant physical activity beyond breathing. At the other end of the heart rate spectrum does exist something called the maximum predicted heart rate, which, as the name implies, is the fastest rate your heart can achieve during the most strenuous activity your body can perform. The commonly cited equation for predicting the maximum heart rate of a person is 220 minus their age in years. Unfortunately, while it's simple to remember and even more simple to apply, most exercise physiologists feel it's too inaccurate, and there have been many attempts to better refine it. But for today, we'll be focusing on the heart rate at rest. The next thing to clarify is the age of the person we're talking about. Just as age impacts the maximum predicted rate, it also impacts the resting rate. Specifically, children have faster rates than adults, and infants have faster rates than children. In fact, the age at which the resting heart rate is the fastest, 9 to 10 weeks after conception, when the average rate tops out at around 170 to 180 beats per minute. Over the next several weeks, the rate slows down just a little until settling out somewhere between 120 and 160. But unless you're an obstetrician or a neonatologist, you won't need to worry about fetal heart rates. So for the rest of the video, I'm going to focus just on the normal resting rate in adults. Since there are so many adults in the world to examine and to study, and since the heart rate or the pulse is arguably the most fundamental and basic of all physical exam findings, you might assume that there's already a consensus about it. In fact, there's actually a very strong consensus among major physical exam textbooks, among guides to ECG interpretation, and among instructors in medical and nursing schools. That consensus is that the normal resting heart rate in adults is between 60 and 100 beats per minute. Any rate below 60 is considered to be a bradycardia, which is literally Greek for slow heart. Any rate above 100 is considered to be a tachycardia, which of course means fast heart. This 60 to 100 consensus is so strong that I've honestly never heard a member of a medical school faculty, excluding cardiologists, teach to the contrary. So what's the problem? Well, there's three of them. The first problem is the evidence. The largest relevant study was performed in 2007, when investigators sought to remeasure and potentially redefine the normal values for a number of aspects of resting electrocardiograms, or ECGs. This included the duration of certain waveforms, the average directionality of the electrical potential vector, which is called the QRS axis, and yes, the heart rate. Their study subjects included 44,000 adults who had been identified as having very low probability of cardiovascular disease. So what did they find? The median adult heart rate, which isn't exactly the same as average heart rate, was 67, with 96% of the subjects falling between 48 and 96. There was an extremely slight gender difference in that women's rates were 1 to 2 points higher than men's. These findings of a slower and slightly broader range of normal, as well as a gender difference, were consistent with previous smaller studies. The second problem is expert opinion. In my own personal experience, every cardiologist I've ever talked to about this issue has voiced the opinion that 60 to 100 is too high, particularly the lower bound of 60. In 1992, a survey was sent to 150 prominent cardiologists asking a simple question: should the limits of a conventionally defined normal heart rate be changed from 60 to 100 to instead 50 to 90? Should it remain the same, or should a different range be used? 136 cardiologists responded. Of those, 123, or 90%, agreed with the proposal of 50 to 90, 6 voiced preference of 50 to 100, and only 2 preferred the traditional range. And the remaining 5 had a variety of responses, all of which were slower. Additional evidence of expert opinion on this issue comes from critical care medicine. In 1992, a consensus committee from the American College of Chest Physicians and the Society of Critical Care Medicine sought to establish uniform definitions of sepsis and the systemic inflammatory response syndrome, or SIRS. For consistency, this committee described SIRS and sepsis as states in which at least 2 of the following physiologic derangements were present: fever or hypothermia, heart rate above 90, respiratory rate above 20, and either leukocytosis or leukopenia. Although it's not explicitly described in the consensus statement, why would they have set the heart rate cutoff at 90 if they believed the normal range to extend above this? It's logical to conclude that the committee also felt that 90 was the upper limit of normal. The last problem with the traditional range of 60 to 100 is its history. Where exactly did this range come from originally? Well, it goes back to the earliest days of electrocardiography. In 1928, the New York Heart Association published their first edition of Nomenclature and Criteria for Diagnosis of Diseases of the Heart. In this book, they defined something called, quote, regular sinus rhythm as a heart rhythm originating from a structure in the right atrium called the sinus node, from where it normally originates, and as having a rate between 60 and 100 beats per minute. But 1928 was decades before any formal study was conducted into the normal distribution of heart rates in the population. So how and why could the New York Heart Association come up with such a range? Well, it was put by Charles Kosman, an early member of that group. It was for, quote, the purposes of standardizing electrocardiographic nomenclature. These limits and terminology are used principally for convenience and uniformity of designation. They do not define normality except in a gross way. However, in 1943, that same New York Heart Association renamed regular sinus rhythm as normal sinus rhythm, a decision which may have been responsible for creating this whole misconception to begin with. And if that didn't feel arbitrary enough, consider why the specific range of 60 to 100 was the one chosen for standardization. Standard electrocardiograms are printed on graph paper, which is divided into large boxes, 5 millimeters on a side, which are then further subdivided into 25 smaller boxes, 1 millimeter on a side. It's the large boxes that we're interested in. The ECGs are printed out at a rate of 25 millimeters per second. Therefore, along the x-axis, each large box of 5 millimeters represents 1/5 of a second, or 200 milliseconds. This has been standard convention since before electrocardiography was really introduced commonly into clinical practice. As a consequence of this convention, an interesting trick for quickly estimating heart rate becomes apparent. The heart rate is equal to the number of large boxes between successive spikes, known as QRS complexes, divided into 300. So if there are 2 large boxes between each QRS complex, the rate is 300 divided by 2, or 150 beats per minute. If there are 4 large boxes between each QRS complex, the rate is 300 divided by 4, or 75 beats per minute. How this becomes relevant to our 60 to 100 range is that when one is trying to determine if something is normal sinus rhythm or a tachycardia, that is a rate that's too fast, if we use 100 as our cutoff, one only needs to see if the number of large boxes separating complexes is more or less than 3. More than 3, the patient has normal sinus rhythm. Less than 3, the patient has a tachycardia. That can be determined by inspection instantaneously. However, if we use 90 as our cutoff, we would need to see if the number of large boxes separating complexes was more or less than 3.33. A little more awkward and not quite as automatic. So in essence, the decision to make the upper bound of a normal sinus rhythm at 100 was because it allowed for a trivially easier time interpreting ECGs. And even this ridiculous reason has been made obsolete by the use of ECG machines, which now automatically calculate the rate with extremely high reliability. So the traditionally taught range for normal heart rate is not supported by evidence, it's not supported by expert opinion, and originates from a completely arbitrary quirk in how ECGs are recorded. There's just one more issue to consider. That is, what do we even mean by the word normal when we discuss the normal heart rate? Are we referring to the statistical average in the general population? Or are we referring to the statistical average only in those patients who are known or suspected to have no cardiovascular disease? Or are we referring to a heart rate that will minimize chance of future cardiovascular disease? Put more simply, does normal mean typical or does normal mean healthy? A 1990 study looked at the association between heart rate and mortality in 1,800 patients who were admitted to the hospital with a heart attack. This graph here shows the patient's mortality in the first year after the heart attack as a function of their final recorded heart rate immediately prior to hospital discharge. We see that the mortality for heart rates of 50 through 89 are uniform, but once the rate at discharge creeps above 90, mortality starts to climb pretty rapidly. But the danger of faster heart rates isn't limited to just patients who've had heart attacks. In a study of 56,000 patients without known heart disease, the faster the resting heart rate, the increased risk of a major adverse cardiovascular event such as a heart attack or cardiac arrest. And this trend persisted even after statistical adjustments were made to account for the presence of high blood pressure, high cholesterol, diabetes, smoking, obesity, and lung disease. So even if one believes that resting heart rates of 90 to 100 are statistically within 2 standard deviations of average, which they probably aren't, they don't seem to be markers of good health. So going back to our original question, what is a normal heart rate? Well, it depends on who your patient is and what you mean by normal, but it's probably not 60 to 100. Thanks for watching my experiment in a new video style on this channel. Please let me know what you think of it in the comments. Keep in mind that if I continue to make some videos in this style, they'll be occasionally mixed in with my typical med-ed material and will not be displacing it. And if you're new to my channel, and this is the first video of mine you've seen, welcome. Please don't forget to subscribe, and that way you won't miss out on any of the videos to come.